This video provides an overview of the effective utility and benefit of the GaP ring device. The utility of the GaP ring is demonstrated by comparing the post-operation anatomy of the gastric bypass with and without a band in place. In this procedure, the pouch outlet restricts the rate of food emptying from the gastric pouch. Such restriction allows patients to feel the sense of satiety after only filling the gastric food reservoir located proximal to the pouch outlet. This is referred to as the restrictive mechanism of the gastric bypass procedure. However, in the natural anatomy of the gastric bypass, as patients increasingly ingest solid foods, the gastric pouch, pouch outlet, and proximal jejunum will dilate. Specifically, pouch outlet dilation corresponds to a loss of the restrictive mechanism of the gastric bypass. Loss of restriction at the pouch outlet allows an increase in the rate of food emptying from the pouch into the proximal jejunum. This results in the formation of a dilated gastric food reservoir, which patients must fill to feel the sense of satiety. Pouch and pouch outlet dilation are considered complications of gastric bypass surgery. In the banded gastric bypass, the ring is initially placed loosely around the gastric pouch. In the short term, immediately after surgery, the anatomy functions the same as the gastric bypass, with the surgically created pouch serving as the gastric reservoir and the gastrojejunal anastomosis serving as the pouch outlet. However, as the pouch naturally dilates, the ring forms a new pouch outlet above the anastomosis. Though there still involves a degree of gastric pouch dilation, the stabilized pouch outlet provided by the ring will restrict the rate of food emptying from the area proximal to the ring. Patients need only fill the gastric food reservoir proximal to the ring to reach satiety, and even though dilation distal to the ring is a result of the natural anatomy of food digestion, such distal dilation is inconsequential to the amount of food the patient can ingest. By providing a new stabilized pouch outlet, the ring prevents the formation of a dilated gastric pouch consisting of the pouch, pouch outlet, and the proximal jejunum, and reduces the risk of associated complications. The following demonstrates the dilation of the gastric reservoir with and without the ring in place. With the GaP ring in place, the stabilized pouch outlet reinforces the restrictive mechanism of the gastric bypass operation, resulting in a slightly dilated gastric pouch proximal to the ring. The proximal pouch serves as the gastric food reservoir. Absent any reinforcement, the pouch outlet will dilate, resulting in the formation of a gastric reservoir consisting of the pouch, pouch outlet, and proximal jejunum. In some patients, the loss of restriction is associated with additional complications and may possibly require a secondary procedure to address the complication of pouch and pouch outlet dilation. This comparison demonstrates that the presence of the ring in its proper place will provide a stabilized pouch outlet, thus limiting the pouch dilation and other associated complications.
Thank you for your attention, and please contact Barry Tech Corporation for more information on the GaP Ring Autolock system.